With the new year just around the corner, you might already be thinking about your resolutions, and surveys show that losing weight is consistently a top goal. But shedding those extra pounds isn't always that easy, and the health benefits should be top of mind all year long. Medical advancements have made weight loss more attainable for many, and in this sponsored segment, we are joined by Lizette Alvarado from SYN Skin Aesthetics Health and Wellness, who is not only a practitioner, but a real-life success story too. Hey, Lizette.
Hi, thank you for having me.
Well, I think we were going to show some pictures here in just a second that show you are your own success story. Tell me about your weight loss journey.
So I've had 3 children, and in that journey, I tried diet, I tried exercise, and was not successful. Therefore, I looked into the medical weight loss aspect, and so I started on semaglutide, which is a GLP-1, one of the medications. It's the compound for Ozempic.
Yeah.
And so I lost 90 pounds with that, and I've
I'm
sustained
looking at
it.
the picture.
Yes.
Oh my gosh.
So 90 pounds later, this is where I am. I maintain and sustain. It behaviorally train my brain, so I eat differently and I exercise. Because exercise and diet is huge. You have to
Right, you can't just neglect those things, but for folks who have tried that and it's just not working, this can kind of be that extra push. So what does it do? How does it make you lose weight so quickly?
So GLP-1 is a hormone that stimulates your pancreas, our workhorse, and it secretes insulin more rapidly and readily to break down those sugars and carbohydrates that line the vessel and that make the fat around our organs. It's called visceral fat.
Okay.
So it breaks that down. A lot of patients start off with losing inches before pounds. Okay. It slows the stomach emptying down. That's where the side effects come from.
Okay.
But it keeps you fuller longer, satiated quicker, and you eat less often.
So you're less hungry.
Correct. And then the behavioral component is huge when it comes to obesity. It's not just a medical thing, it's behavioral. So it trains your brain, works on addictive behaviors. The food noise is gone. So therefore you're not snacking, you eat less, and when you do eat, you make better choices.
Right. Oh, wow. That sounds exciting. Who qualifies for this? Because you mentioned some side effects. Are there certain people who this drug just isn't good for?
Correct. So anyone that has any risk for thyroid cancer, a family history of that, or a current history, any pregnant or breastfeeding moms, absolute contraindication. But you should have at least a BMI of 25 or more.
Okay.
And need significant screening, laboratory studies before you get this medication and see, a professional, clinical, medical professional that is following you regularly.
And you mentioned at SYN, y'all have 3 medical professionals among, other
Correct.
staff that are kind of looking out. Can you tell me a little bit more about the rigorous process to qualify for these drugs to make sure that patients are good to go before they take them?
So we do a full physical exam, medical, surgical, family history, screening, laboratory studies. You're followed every month. Me, myself, the family nurse practitioner, my father, Dr. Alvarado, and we have a pharmacist on staff as well. And we work together to make sure that our patients have a custom plan to be successful, because those side effects can happen and you want to make sure you have a qualified providers who manage them. Some of the side effects include nausea, constipation, so you have to have someone that knows how to manage that. You can get pancreatitis, so they need to watch your liver enzymes, your pancreatic enzymes, and safely dose you to a therapeutic dose range.
So if you're on those drugs and you're having those symptoms, you should certainly see a professional who can help you kind of dose back if need be.
Definitely, or stop the drugs immediately.
Sure. The next question is insurance. These drugs can be expensive, but some people can get qualified for insurance to cover it.
Definitely. So Ozempic, Wegovy, Mounjaro are your brand name GLP-1 drugs.
Okay.
And so we have a nurse dedicated that does prior auths, but unfortunately most of the meds are covered for diabetics. If you're not a diabetic, we have Wegovy, is FDA approved for obesity. However, if we can't get those covered, we have the compounds, which are semaglutide, which is the Ozempic generic compound, and then Mounjaro's compound, which is tirzepatide. But we do work hard, and there are some patients that we can get it covered for.
Wow.
Like insulin resistance, PCOS, things like that.
And I know, you're a success story in and of yourself, but I'm sure you've seen patients who have also seen success with this. And I imagine that it's not just the physical benefits, but it's the mental benefits.
For sure. We have taken patients out of depression. We've had patients that have gotten off of their hypertension medications, hyperlipidemia, and in the long term, hormonal and even thyroid issues that has helped patients with, and PCOS and things of that nature. But I have seen beautiful success stories of patients that have bloomed and blossomed because of the weight loss and health at the end of the day. It reduces your risk for coronary artery disease by 25%.
Thank you so much for coming and talking
about
this,
me.
because lots of people are talking about it. Lizette Alvarado from SYN, thank you so much.
Thank you for having me.